Oh, hey! It's me, Raphael. Welcome back to January 2020 when we were still Coatesville Area Senior Center, now Brandywine Valley Active Aging. For now, let's talk about Coatesville Area Senior Center. I promise you, we will talk about Brandywine Valley Active Aging before our time together is over. The future was looking bright for Coatesville Area Senior Center. 2020 was going to be our year to shine. A new chef had been hired and Nostalgia Kitchen was on the verge of greatness. The board of directors and staff were working on a strategic plan and Coatesville Area Senior Center was excited to present several new programs and services to our community. Wait. What is this? Who are you? Oh. You must be the COVID virus everyone is talking about. You are going to have a severe impact on the world and on the way we do business. But at the Coatesville Area Senior Center, we are going to do our best to continue to serve our community and work around you. Come with me now as I walk you through a year of Coatesville Area Senior Centers, now Brandywine Valley Active Aging's response to COVID-19. January 2020 would mark the first known case of COVID-19 in the United States and, like most senior centers throughout Pennsylvania, Coatesville Area Senior Center was forced to close our doors on Friday, March 13, 2020. Not willing to surrender, the team at Coatesville Area Senior Center would return to work on Monday, March 16, 2020 and begin building the framework to ensure continuity of service to the greater Coatesville community. With little time for debate, staff met to discuss and deliberate three key questions. 1. Should Coatesville Area Senior Center remain open? 2. If Coatesville Area Senior Center were to stay open, what services would be provided? 3. How would the identified services be provided safely and with as little disruption to normal as possible? The first question was easily answered with a resounding yes from everyone in the room. When approaching question 2, staff would quickly realize that looking back to the roots of the senior center is where the answer could be found. First introduced in 1943 in New York City, senior centers were established to combat food insecurity, encourage friendship and camaraderie to ward off social isolation and to build a strong network of supportive services to ensure older adults would age with dignity and remain in their homes and communities for as long as possible. These three founding principles would become the driving force behind the Coatesville Area Senior Center's COVID-19 pandemic response. When our world changed, Coatesville Area Senior Center changed with it. On behalf of the Coatesville Area Senior Center team, we hope that you find this presentation both informative and inspiring, and we hope that you will continue to support us as we inspire our community to get busy living. For more than 4 decades, sharing a noon meal with friends has been at the heart of nearly every senior center across the nation. The noon meal program ensures more than access to a healthy meal, it ensures the opportunity to build friendships and meaningful relationships. Prior to COVID-19, more than 80 older adults per day would gather around the dining room tables of Coatesville Area Senior Center to enjoy a noon meal and friendship. Continuing the noon meal program throughout the pandemic was critical to ensuring older adults would have access to at least one healthy meal per day. Building on existing partnerships, Coatesville Area Senior Center would work with the Chester County Department of Aging Services to open our grab-and-go drive-through meal program. At the height of the pandemic, the program would provide meals to more than 250 individuals per day. Recognizing that our resources could not keep pace with the growing demand, Coatesville Area Senior Center partnered with the Chester County Department of Aging Services and the Pennsylvania National Guard to distribute more than 21,000 meals to 5 senior housing buildings in the city of Coatesville. In addition, Coatesville Area Senior Center expanded its partnership with the Chester County Food Bank, distributing more than 75,000 pounds of fresh produce, dairy, and groceries. Through the course of the year, nearly 1,000 individuals would rely on Coatesville Area Senior Center with more than 35,000 grab-and-go meals prepared and served in our drive-thru, more than 21,000 MREs distributed to 5 senior housing facilities, and more than 75,000 pounds of fresh produce, dairy and groceries distributed. Combined, the demand for food has increased by more than 200% over the previous year. As our pandemic response continues, access to food remains a top need of the older adults we serve, with more than 200 visitors per day receiving meals and other food items. Here are some pictures from the drive-thru, the produce delivered and the MRE boxes that were given out with the help of the National Guard. For many older adults, Coatesville Area Senior Center is the primary source of trusted information. It would be critical to identify the most effective method of communication. ensuring that our members would continue to have access to meaningful information about COVID-19 and how they could protect themselves from the virus. Second to face coverings, social distancing would become the second most powerful tool in combating COVID-19. However, social distancing was not without its own set of concerns. Loneliness and social isolation in older adults are known to be serious public health threats, putting many older adults at greater risk for dementia and other serious medical conditions. At Coatesville Area Senior Center, we realized we would need to provide safe opportunities for older adults to stay social in a socially distanced world while being mindful of public health risks. Each year, 2.8 million older adults visit an emergency room because of injuries they sustained as the result of a trip or fall. Physical decompensation is a normal condition of the aging process. To address this concern, Coatesville Area Senior Center generally provides more than 5,000 hours of free or low-cost exercise instruction specifically designed for older adults and targeting agility, balance, flexibility, and strength. Of those who actively participate in one or more of the Coatesville Area Senior Center exercise classes, 85% maintain or improve their functional fitness, and so continuing to provide access to exercise classes would be an important part of the Coatesville Area Senior Center COVID-19 response. To keep our members informed and safe, Coatesville Area Senior Center subscribed to a mass calling broadcast service. This service allowed important messages to be shared with more than 2,000 individuals weekly, and sometimes more frequently. The mass calling broadcast system has been used to convey important COVID-19 information, including announcing stay-at-home orders, encouraging the use of available senior center services, alerting individuals to inclement weather, and to inform members of COVID-19 testing and vaccinations. As weather conditions improved and mitigation efforts were better understood, the introduction of outdoor events became a new way of providing social opportunities that would encourage friendship and fun. Parking lot concerts, drive-through health fairs, and even themed parties in the drive-through would become popular highlights of the long months of voluntary quarantine. The advent of technology allowed Coatesville Area Senior Center to keep our members connected and engaged by bringing age-appropriate programming to the comfort and safety of members' homes. Using platforms like Facebook Live, YouTube, and Zoom would allow exercise programs to continue. Reimagining the vintage party line, popular programs like Bingo and Pokino would provide much-needed entertainment to help pass the time. Through the virtual campus, professionally led lecture series on topics of interest such as Medicare, long-term care, history, language, and even beer making and tasting would be available to anyone with access to a computer and internet. Our new technology lending program ensures that anyone who wants to connect to the virtual campus has the ability to do so, keeping members connected and engaged. Here are more pictures of how we kept in contact with our older adults. Handmade greeting cards, concerts in the parking lot, and handwritten letters. Among all of our efforts to fight social isolation, it has been our experience that the most effective and appreciated way to keep in touch with the older adults we serve was to simply pick up the phone and call them. For many, a friendly phone call was the perfect medicine for fighting off social isolation. Chester County is home to more than 88,000 adults aged 65 and older. For many of these individuals, the cost to call Chester County home results in a choice between paying for housing or purchasing medications. Each year, Coatesville Area Senior Center provides direct one-on-one support to more than 1,000 individuals, helping them navigate Medicare, assisting them with filing their federal and state income tax returns, and ensuring those who qualify receive their Pennsylvania property tax or rent rebate checks. With careful planning, the team at Coatesville Area Senior Center, working closely with the County of Chester, was able to develop plans to safely allow for the continuation of these life-saving one-on-one appointments. Despite the pandemic, and relying on strong partnerships, Coatesville Area Senior Center was able to help more than 400 individuals file their federal and state tax returns, and to assist more than 300 individuals in completing applications to receive Pennsylvania property tax and rent rebates. In addition, the Coatesville Area Senior Center team answered more than 25,000 phone calls, providing answers to questions or offering referrals to other community organizations or government agencies. January 2021 brought hope for a better tomorrow. Vaccines began making their way into the arms of millions of frontline healthcare workers and older Americans, giving hope for life beyond COVID-19. January 2021 brought the official announcement of Brandywine Valley Active Aging. Who is Brandywine Valley Active Aging, you ask? Well, that is a great question, and I have the answer. Brandywine Valley Active Aging was inspired by the thought leadership of Coatesville Area Senior Center, and brings together Coatesville Area Senior Center and the former Downingtown Area Senior Center. Inspired to ensure future success, Brandywine Valley Active Aging now manages 3 campuses. Our main campus, the Coatesville campus, remains in the city of Coatesville at 250 Martin Luther King Jr. Boulevard. Our Downingtown campus has been returned to the borough of Downingtown, temporarily located at Brandywine Grace Church. This strategic relocation had an immediate positive impact on the communities served by the former Downingtown Area Senior Center. Our third campus, the virtual campus, brings popular programs and services to the comfort and safety of participants' homes. Prior to COVID-19, an estimated 10 million older adults received one or more services from senior centers throughout the country. Understandably, the coronavirus pandemic has resulted in the temporary closure of many senior centers across the nation, the Commonwealth, and here in Chester County. COVID-19 has put many seniors, even those with stable income, at greater risk for food insecurity as their individual safety nets have collapsed, reliance on family, friends, etc. Additionally, COVID-19 has heightened concerns as older adults are at risk and many, if not all, express their concern and fear of COVID-19 in addition to their increased feelings of social isolation. While Chester County has reached the green phase of Governor Wolf's strategic phased reopening plan, and despite the rollout of COVID-19 vaccines throughout the county, the risk to vulnerable populations continues. Until it is determined safe to return group activities inside our physical campuses, Brandywine Valley Active Aging will continue to work collaboratively with the Chester County Departments of Aging and Health to meet the needs of older adults while being mindful of health and safety restrictions as directed by local, state and federal authorities. Whether you knew us as Coatesville Area Senior Center, Downingtown Area Senior Center, or Brandywine Valley Active Aging, we are grateful for your support yesterday, today, and in the days that follow. Together we will get through this, and together we will come out stronger on the other side. For more information on Brandywine Valley Active Aging and our programs and services before, during, and after COVID-19, you are welcome to visit our website at www.bvactiveaging.org, or by calling us at 610-383-6900. Thank you for joining me today, and I hope to see you soon at Brandywine Valley Active Aging. To our donors, funders, and sponsors, thank you for your continued support. From the whole Brandywine Valley Active Aging team, stay safe, be healthy. We miss you. Brandywine Valley Active Aging, where we inspire you to get busy living.